context
sounds... headbutt a kid?
No, I didn't mean it. I was like... headbutt a kid.
You might be one of the strongest people on this table. I'm kidding. I've had stronger people. I'm kidding. No, I haven't. I don't know what's going to offend them more.
Never been touched like this.
So, the rusty needles that I usually use will be fine today.
No, you're just trying to find an excuse to oil me up.
Dude. And if you do move muscle with needle inserted, that can cause a little bit of small tearing.
Woo!
Feel that one, huh?
Yep. Oh, God.
I think you deserved that one. I honestly think you deserved that one. Tareq.
Yeah.
Good to actually see you in here for a change. Yeah, so stop it, dude. Tareq has not just met me. Tareq and I have been going to the same gym for, how long have we been going to Good Life for?
2 years?
2 years, yeah. So about 2 years. We joined around the same time. And we've kind of been like gym buddies since, even though we just kind of learned each other's names maybe about a few months ago. That's kind of the way that gym buddies go.
He's cheating on me.
That's you know what? I'm not loyal. Not in the gym environment.
I knew his name before he knew mine.
Well, I just learned that it's properly pronounced Tareq. He told me there's 20 different ways to do it. Apparently.
See, I don't even blame him. Like, at the gym we go to, there's like people say it.
Hey buddy, Tareq.
I had to correct my coach 5 times.
Oh my gosh. All the same, Tareq is in today dealing with some reoccurring shoulder issues. You mind sharing with us exactly what's going on?
Yeah, of course. So recently I've been having shoulder issues with my right shoulder, and this started about a month and a half ago, maybe 2 months, if not.
Okay.
So I went on a vacation during summer, which obviously made me lift less. I still tried to get some lifts in here and there, like
Good.
maybe like
Nice.
So first week I went on a out of the country vacation, so I didn't lift at all. And then I came back camping, and then when I was camping, I switched up nearest gyms, and there was one 25 minutes away. So I went 3 times in that week. So maybe about 2 weeks and a half of like semi lifting. So like maybe I went a total of 4 times to the gym in like the whole month. So my body wasn't used to it. So when I came back, I entered a calorie surplus because I was still eating. I was on vacation. I was going to allow myself. So I was still able to push relatively...
So sorry, when you came back, you entered a calorie surplus?
No, when I was on vacation, I was on a calorie surplus.
Of course.
So when I came back, I was heavier.
So you went on a calorie deficit?
Yeah, I was already on a cut, and then the vacation came, and I took a break, and then I went on the cut again. But when I came back, I was heavier, and because I was in the surplus, I built up energy, and I had, I guess, strength.
You felt strong.
Exactly. So when I came back, I was like immediately jumping right back into the weights I did, and the whole point So when I was lifting during the camping, like the 4 times I did lift, the whole concept in my head was like, okay, I'm gonna do this so I'm not rusty when I come back. It's
of course. You want to try to maintain the conditioning.
Exactly. Right? So I come back, and first 2 days are fine, and then arm day comes around. So I start with a heavy shoulder press.
My favorite day. Yeah.
I love arms. Yeah. I start with a heavy shoulder press. And here's the thing, at the day of, it was all fine and dandy. Like, I actually maxed out that day. I was with my friend, other Adam.
I know other Adam. He's a power lifter. Yeah.
No, not even that
No,
Adam.
Not that Adam.
It was,
there's another Adam.
It's a blue-collar Adam.
Blue-collar Adam. So this is blue-collar Adam, there's other Adam, and then there's Dr. Adam.
Yeah.
Okay, yeah.
So I maxed out my shoulder press at 110.
Yeah.
And then it's all fine. But here's the thing, when I shoulder press, I go up. And then when I'm at my failure set, I twist back in.
Okay.
So I think it was that, or the movement of me kicking it up and twisting. So... At the day of, it didn't tweak. The next day, it's a rest day. I didn't feel it. I have bench 2 days after, like arms, rest, and then it resets. So 2 days later, I have bench. When I bench, I'm like, whoa, clicking.
Something's clicking. Something's wrong.
like there's tension. I'm feeling it. On flat bench, it's like, okay, there's like a slight pain. I'm like, okay, maybe I pulled it slightly. The real pain comes when I do shoulder press again or incline dumbbell. It is very painful when I when I start warming up. Even with the 50s, I'll kick up 50s and super sharp pain, and it hurts.
Now,
when I get heavier, it gets lighter.
Is that pain, it gets worse as it gets heavier? Yeah,
no, actually it goes down.
Goes down to heavy.
It's like it's warmed up.
Okay.
So when I first start cold warm up, it's so painful. It hurts. Even with my shoulder press, 60s out.
But you're able to work through it though. Like you're able to push through the warm up and then ultimately do your shoulder press with minimal pains afterwards, or is it's bad?
So it starts bad.
Okay.
And in my head, I'm thinking maybe I just need to warm it up. So this is after one session. So I warm up, I get to 50, 60, 70. By the time it's at 70, now it's a slight tension pain, but it's not the same pain as it was.
But it's not the same as it was
No,
before.
but every time when I start, it's severe. Incline dumbbell and shoulder press, it hurts.
Okay. The good news is that he's still able to do what he wants to do. Okay, you're still able to maintain activity levels. It's probably getting in the way of your goals a little bit, but it's not so much that like, he's got to completely stop doing. Okay, those are the injuries that can really completely change a person's life. Good news is that that's not your case. Okay.
This does hinder a bit, though.
Of course it hinders. I'm not denying that whatsoever. But the fact that it improves with movement is very beneficial, because they're the people who, if they have a shoulder condition like this, it doesn't improve with movement. Okay, and that's when there's a problem. That's when there's a genuine problem. The shoulders are weird joints because they, by nature, are super mobile. They're the most mobile joint in our body because we need to be able to do all of these different things, right? You can compare that to the knee, which is a hinge joint, which can only go up and down and maybe like a little bit of external rotation. So to that end, the stability capabilities of our shoulder are largely managed by the muscles that surround them. Okay, that includes the rotator cuffs, that includes the deltoids, that includes the serratus anterior, that includes the rhomboids, the traps, obviously the joint capsule. Do you know what all those things are, out of curiosity?
So I know most of them, but I don't know what the joint capsule is.
The joint capsule is just the ligament that encapsulates it. Okay. But that itself offers very little stability as compared to everywhere else in the body. Are you aware of the serratus anterior muscle?
No.
No? Okay. So the serratus anterior muscle is often not known by a lot of gym bros, but have you heard of the boxer's muscle? You know, if you ever watch a boxer punch, you see like on their ribs, they look like kind of ribs
it's like a long...
Kind of. Yeah, it's long and it hugs kind of the ribs in that manner. All right? That muscle is the muscle that helps prevent things like scapular winging and helps to actually adhere the scapula to the rib cage. Okay, and very often he hasn't been getting the attention that he needs when we get shoulder stability complaints, in addition to all the other rotator cuffs. So long story short, I'm going to walk you through some serratus anterior exercises today.
Okay, yeah.
I think that might be greatly beneficial. I also want to see what your lifts look like in the gym over there.
Okay.
We won't be able to do that one on camera because the filming becomes a nightmare in the gym, but I'll reiterate it all to you guys later. And then you also said you had some lower limb complaints. So tell us about those. I'm not sure if we'll have the time to do them today just because filming schedule is difficult.
Of course.
But all the same, tell us about them so that we know.
Okay, so I think the priority one is the hamstring. So about a year and a half ago, or even 2 years ago, there was a Halloween party.
Oh, that's a great story already.
So my smart ass decided to do the splits. To be fair, let's rewind it a bit. Context. I did Taekwondo for 8 years, so I was very hyper flexible, and I used to be able to fully do it.
Okay.
So I'm out of practice for like 5 years, and I go to attempt the front one, not the side one.
Okay. Front one maybe, side one no.
Fair enough. So when I do it, but that's when I immediately pulled my left hamstring, and then first week it was bad, and then ever since then it just kind of faded away. But there's always still that like hovering pinch.
Now that pinch, is it behind the knee or is it deep in the glute?
It feels like it's like right between my glute and hamstring, like
right
under my butt cheeks.
So deep in the glutes then.
Yeah.
The hamstring originates off something called the ischial tuberosity, which is our sitting bone, deep in the glute. Okay, so that's likely. Also, when you do the splits and you get that yank, you're more likely to injure the tendon than you are the muscle belly itself. So that makes a lot of sense. People who've had complaints like that, usually I do acupuncture, so I'm actually literally stabbing them in the ass. And that does tend to help. Yeah, he would get excited.
Whoa,
okay.
Whoa.
It's too early in the afternoon.
I don't know. My girlfriend might be watching this.
I got a girlfriend now.
Recent development.
Oh, okay. Oh, man, he's a handsome dude. All right, so we can do that today, no problem. One other thing that we should be wary of is if you are having mechanical issues, right, or biomechanical issues like movement with your shoulder, your hips, your whatever, you get compensation in other parts of the body. Okay, so the shoulder is very connected to the neck and the upper back. The hamstring, which connects into the glutes, is very connected to your lower back.
So, funny thing, remember how we did the test with the arm where like my left arm's stronger than my right arm resisting was? So me and my coach, we did that with my legs actually, and it's actually opposite across. So my right leg's strong, my left leg has like, you can fully just push it down. It just has no strength when it comes to that. So that's where I feel like issues like that are definitely hindering my lifts, because if it's that significant where like someone could just resist it with like their fingers and it just has no resistance. Also, what I was worried about, it's almost been like, I guess 2 years, because it was on Halloween 2 years ago, I think.
Yeah, it's almost 2 years. It's almost Halloween. We're filming this. I don't have.
Oh yeah,
but,
today's the 25th.
Oh man, okay.
So my concern is, do you think the pole or like whatever the injury was possibly could have recovered in that injured state, and now it's like unfixable, or like?
I don't think it's unfixable.
Okay,
I'll tell you that right now. Okay, but what can happen is when you have a tendon complaint, which is what's more likely to be injured in sudden pulling, things like that. Okay. What can happen if it's not rehabbed correctly is you can turn what is a tendinitis complaint or inflammation within the tendon into a tendinosis complaint, which is actually degeneration of the tendon.
Oh.
Okay. But degeneration is fixable.
Okay.
It just takes longer, and you need to be able to exercise it in the right way.
Okay.
So you'll understand this language. Eccentrics. You know what an eccentric movement is, right? You want to load your hamstrings as heavy and as eccentrically as possible. Okay. I don't know what your lower body days have looked like. I don't know if you have been absolutely in love with Romanian deadlifts, but RDLs, they are the things, RDLs. Those are the things that I prescribe to people who are having proximal, which is deep in the glute, hamstring, tendon degeneration complaints, which based off the history is what I think I think you currently have.
So here's the thing. Actually, I used to do RDLs really heavy. But,
how long ago?
Ever since I would say maybe even 5 months ago I stopped. So what happened was, ever since my hamstring started like acting weird again, I was like very hesitant because
of course
I have a friend that goes to like he's enhanced and all that shit, so they're more prone to like tearing their tendons.
Yeah, so that's the thing. You are all natty, okay?
Of course,
as far as I understand that. So you aren't at the same risk of re-tearing a tendon as compared to somebody taking.
I understand the difference. His muscle mass progresses faster than his tendons can adapt.
I was going to explain that, but he just explained it for you guys.
But for my issue is like after I saw him tear his hamstring, I was so paranoid because I still have the pinch when I lift. So what I did, I opted out doing RDLs, and now I either do dumbbell RDLs with the weight I can manage comfortably, or I go on the hamstring machine, the one like where you curl outwards.
Yeah, also sure.
Like again, significant weakness in the left hamstring compared to the right one. I'm scared of putting enough load on it, or I feel like it just snap.
Yeah, it won't. Okay, so there's no way to say this other than the fact that it won't. Okay. So fear of movement, kinesiophobia, is a real thing for people who have either had an injury related to movement for a long time or are surrounded by people who are consistently hurting themselves. I see the weightlifters who injure themselves all the time, okay? I get a little bit freaked out when I deadlift because of this, all right? It's fine. I know how to do it right. I haven't hurt myself deadlifting in a long-ass time. But still, it's a psychological thing, right? So with the hamstring, you're getting that pinching right now. The acupuncture should help to relieve the pinching, okay? And as the pinching goes away, your confidence in that movement should gradually restore. So if you're still hesitant about like barbell RDLs, fine, don't do barbell RDLs.
I'd prefer to.
Good, that's the right attitude. But I'd say you can do dumbbell RDLs. You can do the leg curls, okay, whatever you want. Just make sure to put a heavy an emphasis on lifting pretty much in the 90% range of what you can manage and focusing on the eccentric.
Is there a rep range I should focus on?
Usually like 8 to 10. So maybe actually drop that to an 80% efficacy, not a 90. But usually 8 to 10 should be 10 to 12. 10 to 12. I'm changing my mind on that. I'm looking for muscular endurance there. That's what you should focus on. The eccentric movement helps for tendon remodeling. Okay, if your tendon becomes regenerated, you need to develop new collagen cells and lay them down in the right orientation. That is done by eccentric movements. Okay. That's a lot of information. If you have questions about it, you're free to ask me afterwards. Makes sense. Okay, so we got that hamstring, we got that shoulder. We're going to go ahead and check the neck, the back, and the lower back because of the compensation effects. But overall, it doesn't seem like anything that's permanent. Okay, it seems like things that can be tweaked. You just need a little bit of guidance into the right direction for that. So what we're going to do is
I've never done physio.
You've never done you've never done physio either. You haven't seen a chiro, massage, and osteo.
Never. I just literally just roll out in the gym. That's pretty much it.
Yeah. How old you're?
I'm 21.
You're 21. Okay. So you're still at that age where like you are quite invulnerable. Okay, I'm telling you now. You're quite invulnerable. Or I'm telling you now, like, I'm 30, okay? I know that I might not look it, but you're going to, around 26, 27, 28 is when your body's going to start feeling these things. Okay. So you getting ahead of it now is going to be very beneficial in the longer run, okay? And sorry to any younger people who are watching me, but it's coming for you too, I promise.
Yeah. 100%. That's the goal. Like, when I first started lifting, also, I had that same mentality. It's like, oh, people, like, around me are getting these pulls and injuries. How come I'm not getting them? Obviously...
Because you are resilient. You're
exactly.
young.
But
that's
also, at the time, as a beginner lifter, I was like, okay, maybe just, like, they're dumb or some shit. Like, I was still, like, not educated enough.
Yeah.
the wear and tear catches up.
Oh,
especially with like when the stronger you get, maybe if you're a bodybuilder and you're doing like controlled movements and like super light weights, maybe not as so much, like it won't come, but if you're lifting heavy enough weight, it's gonna come.
It's gonna come. And it's not, don't get us wrong, it's not gonna disable you. Okay, but it's gonna you're gonna need to start seeing someone. Unless you're done.
Unless you're trying to max out 500%
or enhanced. Alright, stay away from that stuff, guys. Please. Alright, so we're going to get into the physical exam. We're going to treat you today. Any questions before we get started?
No, not really.
Perfect. Tareq is dealing with some right shoulder pain, alright? And he's not exactly sure what is going on here, but it's been bothering you for a couple of months now. Yep, so let's start with a general rotator cuff screening. Full disclosure, I've actually done this a few times already because, we go to the same gym together, so it just kind of pulled me aside, whatever. And it was usually pretty negative on all things. Negative meaning nothing's presentable, but let's go ahead and go through it anyway. Okay. So I'm going to get you to bring your arm up for he's already getting in the right position, right? Arm forward, keep your arm there, don't let me move it, okay? Fight me, strong. Any pain or discomfort with that?
No, but slight tension here.
A little bit of tension there?
The start of, yeah.
Okay, now I get you to give me a thumbs down. Okay, there was a little bit of a click there. Fight me, keep it strong. Better, worse, or the same as before?
Now there's pain here.
Now you're getting some pain in through there. Okay, so we are getting a positive this time. Look at that.
Well, this time's probably not warmed up because every time you catch me, I'm already.
You're already working. That's a good point. All right, fight me. Pain with that or no?
Slight tension here.
A little bit of tension there. Okay. Fight me. Anything
tension here.
So that causes tension in through there. Huh? All right. Bring the hand behind your back for me, please, and try to lift your hand off your back to touch the wall. Is that painful or provocative for you at all?
Not really. Just
Not really?
Tense a little.
Okay.
Yeah.
Was there one movement of all of those that was causing more tension than the others?
I believe it was like the one where you're pushing.
Probably the thumbs down aspect. Okay. So once again, I want you to squeeze this shoulder blade back here. Bring the hand up and keep it there. Keep the squeeze. Fight. Is that different than beforehand?
No, just a slight tension.
Just slight tension. Okay, give me thumbs down one more time. Squeeze. Different?
No pain.
Okay. All right. So when we retract the shoulder blade, two parts here. Let's start with the thumb up and the thumb down. Okay. So no, I'm going to explain this. So that's okay. So that's something called empty can test. Okay, and the empty can test tests for impingements of the supraspinatus muscle. We'll put a picture up of it right there, so Sarah remind me, and I didn't put that there. The supraspinatus muscle is the muscle that's responsible for bringing our shoulder blade up, our shoulder blade, up the first 15 degrees of abduction. So from here to about here, all right? Now, the supraspinatus passes in a very, very narrow area. If there's a decrease of space in that already narrow area, you're going to get a pinching sensation that's going to create tension, okay? When we do the thumbs down, that decreases the space, okay? So it's more provocative in that case. But if we were to bring the shoulder blade back, which we did, we are forcing the space to remain in there because we're correcting the shoulder kinematics. So when no pain is present even after decreasing the space with the shoulder blade back, tells us it is related to his scapular positioning. So what do? That means we got to strengthen rhomboids. That means we got to also focus on the serratus anterior muscle, which was my suspicion back there based off the other orthopedic exams that I've done.
Oh, I got scoliosis.
You do not have scoliosis. You are okay. You are a healthy 21-year-old dude who just needs a little bit of guidance. That was probably pretty complicated for you to understand. I can walk you through the details of my application over there so you know exactly what I'm talking about. But I wanted to just kind of get that out on.
I pretty much understood what you said.
Did you keep up with it?
Yeah.
Okay, good. I'm still going to show you anyways because patient education, that's what we love.
Of course.
All right, face forward for me. Bring your chin down to your chest for me. Does that provoke any discomfort in the shoulder or anything at all?
Not really.
No?
Feels like my traps might be slightly
Your traps are actually a little tight, so that's going to be a stretch for you? Or what does that feel like? Sorry, I keep interrupting you.
Oh, no, you're good. No, it doesn't feel like anything.
Okay, good. Look up towards the ceiling for me. How's that?
Slight tightness in the back of my neck.
Tightness in the back of the neck?
Super slight.
Okay. Rotate your head as far as you can to the right, please. We can get to about 60 degrees as far as you can to the left, please. We get to about 45 degrees. So a little bit of a decrease rotating left as compared to right. So this is probably more tension on this side.
When I was younger in elementary school, so I had an incident in grade 5. I was in gym class, right? We were playing like a game with soccer where you run around the thing and then run into the middle.
Yeah.
I run into the middle and I actually hit my head at another student's stomach by accident. And okay, the context.
You just headbutt a kid?
No, I didn't mean it. I was like, I headbutt a kid. It was. I don't know.
I hate you. I
don't know what you're talking about. For legal reasons, that's a joke. No, anyways, after that happened, I had a severe like neck pull or something, and it limited my rotation heavily for a while.
Okay.
So this took maybe like 2 weeks off from school because I went to the doctor and I could not move my neck.
Rotate
like it was severely painful. Ever since then, I had like a mobility issue where like one side would like turn more than the other.
How's the other kid's digestion?
No clue. So, like, I think it's almost been like 10, 15 years.
All right, so it's entirely possible that yes, you injured something back when that happened. Very often we see asymmetries from the side to side, but this is why it's also important to do a full head to toe screening of range of motion. That's something that I should also be able to help with. I know you've never seen anybody for it before aside from your medical doctor who's probably like, rest it up, you're okay. And rest it up. By definition, you're okay. But I would like you to be able to check your blind spot for the rest of your life. Okay, so being able to rotate to the left, rather important. Give me a tight hug, or no, give yourself a tight hug, excuse me. You know, you can give me a tight one later.
Like this?
And that'll get you to rotate as far as you can to the left. That's an 80 degrees, that's great. Rotate as far as you can to the right. That's another 80 degrees, that's great. So that's fine up there.
Oh, you just reminded me. So, you know this exercise, like when you do this?
Yeah, the stretch?
So, with my left one, perfectly fine. When I do it with my right one, pain.
You get pain, is it
like
kind
it's
of in that
like
area?
Right here,
Yeah.
Like I cannot force it. And then when I force it, it like hurts here.
Yeah. Okay, sounds good.
Just reminded me.
Well, it doesn't sound good, but yeah. Fits what I think is going on. All right, so Tareq was commenting that it's your right shoulder, but your left hamstring.
Yes.
That's hurt ever since the splits incident at a Halloween party 2 years ago. All right. So he said that his pain is most likely deep in the glutes, okay, which is probably off the ischial tuberosity. We'll throw a picture of it up there, where the hamstring tendon originates off of. So, to get started, we're still going to screen the low back because that's what we do. I'm going to go ahead, I'm going to take this leg, you're going to keep your knee straight, and I'm going to lift this straight up. We're going to go as far as we can.
Pretty much there.
It's pretty much, so do you feel this in the glutes?
It's like hamstring.
Okay, so definitely hamstring tension. We are at about maybe 40 degrees, not quite 45 there. Let's compare that to the other side quickly, see if there's an asymmetry. Let's bring that on. Holy kid, there's an asymmetry. So he can do that actively. Like, I'm not even lifting that up. He's at like 80, almost 90 degrees. So yeah, a significant decrease. That's as far as you can go actively. Huh?
Like without pain.
Without pain, yeah, okay. So definitely, he's not lying. Not that I thought he was lying, but that's definitely the case. He's like, so you don't trust me? No? So definitely, and to clarify, when I did that, there was no pain in the back, right?
No back pain at all.
So the straight leg raise screens for disc injuries, perhaps like QL or muscle issues too. But if it's limited to that hamstring, and you especially getting that kind of also in the glutes, that's our problem. Okay, so we handle that like I talked about, heavy eccentric loading, but also if we need to present a window of opportunity, if we need to decrease pain or pinching in the moment, I stab it. All right, we stab it with needles, which we will absolutely.
Sure, you're not from the UK? You from the UK?
No. Why? Did I say something with an accent? I don't get it.
No. They solve all their problems with stabbings.
Cancelled. All right, so Tareq's hamstring issue was on his left side.
Yeah.
Yes? Okay. So the ischial tuberosity, as we've talked about several times, is rather deep in the glutes. So I'm basically just going to stab my fingers in your butt right now. Okay, for a second. So the ish tube, how we're instructed to find it in school, is to locate the gluteal fold, which is literally the bottom of the ass cheek, right there, and then press our thumbs down and up into there. So is that predominantly where you feel most of your discomfort? Is it kind of deep there, or is it a little further down, further up?
Oh, like right there. Probably.
Right there.
I think if you like smudge it slightly to the right, it's usually centered, like around there.
There it is. That's the issue.
Like there's no pain right now because I'm like in a relaxed state, but I'm saying like normally that's like if I put like tension, I don't know, can push against my leg like downward.
Oh yes, that'll actually make it pop more.
Like honestly, yeah, like
right. That's it. Right, I can
downward.
feel that slightly down more. That's the tendon there.
Like somewhere around there. That
so
work.
It's harder to do this on people who squat or have like a good cake down here, okay? Because to push through glutes to get to a very deep structure, the glutes are already a very large muscle in our body, but then let's go ahead and add hypertrophy into that mix, and that's a problem to get through. But needles don't have a problem doing that. My thumbs, however, do. Regardless, let's move up. I know he's saying he has no low back discomfort. That's great. Okay, I still want to feel through for any compensation effects that might have occurred. So me pressing down through the SI joints here, shows that the left side to me is feeling, and I use the term restricted, I'll explain that to you later, restricted as compared to the right, which makes sense because we're already having lower limb kinetic chain issues here. So let's go ahead and stretch this out just a bit as we work our way up into the thoracic spine. We will absolutely be adjusting that SI joint later. Oop, little pop there. I should shut up while I do this. Okay.
Am I supposed to like resist anything?
No, you just try to relax as best you can. Now, I know you got a 200-pound guy pressing down on you, but just try your best to relax, okay?
Yeah.
Okay. I'm going to adjust this middle back here because I'm feeling some tension too. So what I need from you here, first adjustment, baby's first adjustment, is to take a big breath in, all the way out. Push it all out. Good. Sink. Wow. In. All the way out and sink. Whew. You are strong, dude. Jeez.
What do you mean?
We got nothing there. We got a little incidental when we were reaching up, but like this is, wow, okay. I'm actually very impressed. Usually I can break through people, but you might be one of the strongest people on this table. I'm kidding. I've had stronger people. I'm kidding. No, I haven't. I don't know what's going to offend them more. Oh, God.
It's taking my chiropractic virginity. Physio virginity.
Oh, my God. You got to phrase it like that. That's fine. Whatever. You said it. I didn't. Okay. I'm going to bring this over here. We're going to try one more time for this area here. I'm going to get you to take a big breath in, all the way out. Oh. There we go. There was a deep one there. I don't know if the mic picked it up because that was muffled, but you could definitely feel that clunk there as compared to here. So, good stuff. All right. I'm going to take this. I'm going to pull you here. You're going to put the hand right on the elbow there. We're going to bring this up. Bottom leg straight, bottom leg straight. And we're going to get your hips towards the edge here. Bring your hips closer. Wiggle for me.
Let it get discombobulated.
Oh, that's okay. So long as I don't, because if I do, then there's going to be a problem. Ooh. You guys, okay, I'm going to shut up and just see if there's any more there, because I basically just went on positioning. So big breath in, all the way out. Relax, breathe out, sink towards.
Oh. Damn. Never been touched like this.
And only a chiropractor ever will. And only me. You cheat on me, I'll be mad. And just do the other side. He's already in perfect position. We'll keep the same take. Well, no, bottom leg straight. Close. Yeah, good. Top one bent. Nice. I'm going to take this. I'm going to pull your shoulder. Nice. Go right there. Relax that head. Nice. Good. Hips a wee bit closer, please. Nice. Okay. And let's go ahead and get big breath in once again. All the way out. Oh. Good job, dude. Yeah. So there was definitely a lot more on his left side, which makes sense because if you have that hamstring issue, that's going to create movement pattern issues going up the chain, which is why he was more restricted on the left. We're still going to do the right, though. We still want to be comprehensive with what we do. Now I'll get you on your back, please. Do you get headaches by chance or no?
Not really.
No? Okay, good. Wow, that's surprising because you have a lot of tension in the right side of your neck. Are you okay there?
Yeah.
Okay, good. So, ooh. There we go. So the reason that I always want to check somebody's neck if they're having shoulder issues is because, like I said, they very likely get compensation. Now, we already did the base of his upper back. Okay, we managed to get a solid clunk in there. Don't know if the mic picked it up, but I know he sure as hell did. But now we're going to feel through that neck, and there are definitely... Drop the head into my hand.
Drop it?
Yeah, there you go. There are definitely areas of tension that he probably wasn't aware of. Most people don't notice these things until I come around and poke them, especially if they're 21 years old.
You should add the picture of the dolphin.
The dolphin?
There's like a picture going on. It's like where you commit hate crimes. It's like a dolphin, like a rainbow background.
I am not on social media as much as you, apparently. All right, so we are going to adjust the right neck now. Okay, so you've never had your neck adjusted before, right? Have you seen it before? Do you know what I'm about to do?
Crack my neck? Exactly. I'm about to die.
No, you're not going to die. All right, it's very, very rare that two people die in the same day in this office. Okay, so
say what now?
You'll be fine. Don't you worry about it.
Who's the first?
So what I need from you, we don't talk about him anymore. So what we do is we're going to rotate your head as far as you can to the left. Okay, as far as you can. And you're just going to drop your head into my hands. Good. And from this position.
I think I'm not alive.
No, you're still here. I know that you see me and you're like, are you an angel? But you're still
pretty
here.
much.
You haven't made heaven quite yet. Okay.
I see a light.
They say that heaven is open to people who have 10,000 or more subscribers.
Shit, I'm not there yet.
Neither am I. Come on, guys, help us out. All right, we're
right.
going to drop his stuff in the comments, too, or in the description, rather.
Subscribe or
yeah,
you like dating.
Holy shit, dude. You were bad. Okay, this is coming from him, not me. All right.
Subscribe or you owe me baby oil.
Okay. We're going to go ahead and take a look at the left side of the neck now. Jesus. You know, when I said be yourself.
No, this is how my content's usually filmed.
Yeah, that's a fair point. All right. So, left side does not feel as tender as the right side, but we're going to get it anyways. Turn to the right. Good. And drop the head into my hand. Ooh, okay, good.
Ooh.
Good stuff. Oop, Discord notifications.
Discord moderation.
No, I am not a moderator for that cesspool, but I am on several World of Warcraft Discords.
Ah, fair enough.
Yeah, that's me.
As long as you're not playing League.
No, that was high school. I'm never going back to that, man. That was season 2, Diamonds, never again. All right, so that was neck. How do you feel right now? You feel okay?
I think I'm alive.
I hope so. Yeah,
I see a light. I don't know.
A lot of people. That's the camera. Yeah,
no, I'm talking about that light.
That's the ceiling. Yeah, that's fine. That's okay. I see that one too. All right. So next up, we're probably going to get into the acupuncture.
Okay.
Do you want glutes or shoulder first?
Let's do shoulder first.
Shoulder first? All right. We'll get you to sit
I want
up.
to see how it feels afterwards. That's my biggest issue.
Absolutely. So something that I really like to do with my shoulder complaints is dry needling. Why is that? It's because the tendons of all of the rotator cuffs, and again, we're going to be targeting his supraspinatus specifically, but also everything else because I like to be comprehensive. The tendons are deep in there. You have to get through the deltoid heads, which is like your shoulder muscles proper, and those guys are meaty compared to the much smaller tendons underneath. So if you have the knowledge of where each of them pass and how they pass, because we've got a V shape of bone right here that we have to get around, you're able to stimulate them a lot better with the needle as compared to just strict soft tissue work. So let me grab let me sanitize the area first. Fun fact to everybody watching, sanitizing the skin and not sanitizing the skin, with the exception of skin that is obviously soiled, if it has dirt or something on it, makes no difference in rates of infection. It will always be very, very low. But I do it anyways because, optics. So, let's go ahead.
I got tetanus shots.
He also had his tetanus shots, so, the rusty needles that I usually use will be fine today.
No, he's just trying to find an excuse to oil me up.
Dude, stop. You make it too obvious. I'm going to get canceled again. All right. I'm going to go ahead, dry that off, and we're ready to be stabbed therapeutically. So,
He's trying to pin me with Tren.
that's what I'm trying to do is right.
Is it in yet?
Woo! You tell me.
I think I felt it.
Okay, I think you felt it too.
I don't want to look. I hate needles.
You are big and you are strong, okay?
That's why I don't take steroids. I hate needles.
Well, good, I think. So one thing that everybody watching needs to be aware of is when you are doing acupuncture, you need to make sure that you have an understanding of the underlying anatomy, okay? We have, especially if we're up here. Well, I do, okay? You don't necessarily need to, but I do.
Okay.
That's important because why? We have these big air bubbles called our lungs up here, okay? And if we were to be incorrect with our placements, a great thing to do is to not pop them with a small needle. So be sure that you are only ever getting your acupuncture done by a licensed healthcare provider. I say as I once again struggle to get the needle in. So sometimes we can have issues inserting needles on patients who are having particularly restricted fascia. Right? You guys are already familiar with fascia at this point, but especially in an area where you've had injury for a while, I'll explain it to you later, don't you worry. It can be difficult to penetrate through that. So in this case, it's happening several times, but we just keep the course and eventually it'll give in. So that's 3 needles so far. Try not to move your shoulder while these are in. Typically, that's
I'm
not
sweating a little. Can I get a
upon.
tissue?
Are you actually sweating?
Yeah.
I can give you a paper towel.
Put deodorant. I don't know why. Maybe I'm stressed.
There you go. You probably
Like in my armpit. I'm just trying not to move it.
So needles do cause a neurologic effect. Okay, they do cause a sympathetic response.
Okay.
What's your background? Oh, no, right. So
Arab.
you're in graphic design, right?
Oh.
No, not in Arab yet. No. So needles do cause a sympathetic response in people because they stress them out. That can cause people to sweat sometimes, feel faint or lightheaded. Rest assured, you're fine. Okay?
Never been stabbed this many times.
I could always insert more.
No.
No? Okay. Well, I thought I'd offer.
Is it better?
Hmm?
Is it better to insert more?
Not necessarily. Only need to put in as many as you need to put in. There you go. All right. Now, we're going to camp out. Or how do those feel for you? Do they feel painful at all or not really?
The only one that really like made a significant pinch was the first one.
It was the very first one.
Yeah, well, the other ones are chill.
Good. So what we're going to do then is, if you're comfortable with it, actually hook you up to a gentle current. Okay?
What's that?
Electroacupuncture.
Okay.
You heard of it before?
Sort of?
Electroacupuncture is where we then run a current through the inserted needles. Okay? That can cause some activation of the muscle, helps to facilitate healing as well.
So if I move, what happens?
I just wouldn't recommend it because you do have the needles in there. And if you do move muscle with needle inserted, that can cause a little bit of small tearing, which doesn't feel great, right? It's not going to damage you, all right? But it's not going to feel good either. And I don't want you to hurt yourself, especially when we have the internet as a witness. If the camera was off, I really wouldn't care. But I'm kidding, of course.
You should have put baby powder on.
So not sweat?
It's like my one right armpit's sweating a lot, but my left one's fine. How does that work?
Sympathetic response, baby.
That's wild. I don't even sweat this much in the gym.
Really?
Like from my I usually sweat in my body, but not like on my armpit.
So you need to change up your workout, buddy.
No, not from my armpit. I just still sweat.
All right, so we've got him.
Kanye called. Kanye called.
Kanye did not call. If he did, I'd probably be a lot wealthier or in a lot more trouble. Okay, so this is, we've got him hooked up for the electroacupuncture. Now we're going to turn the current on. Let's start with the green here so y'all can hopefully see a little bit of the muscle twitching that happens. So I want you to let me know when you start to feel a gentle pulsation in that front shoulder there, okay?
Yeah.
Okay.
Oh.
You okay?
Yeah, my shoulder has a heartbeat.
You can feel that, eh?
Yeah.
Is that tolerable?
It's a lot, yeah.
Okay. Is it too much? I'll turn it down if it's too much.
Oh, that's right.
Oh, there we go. All right. So I don't know if you guys can see this on camera, but if we look really close, we'll see that his shoulder is actually pulsating. As well. You know what? I'm actually going to move the camera up close so you guys can see that. There we go. So camera, it can come up close. There we go. You see that muscle twitch there? That's what's happening with the pulsations from the electroacupuncture. So that's the exact effects that we're looking to get as we do this. Really cool that we were able to see that. Let's reposition this here. Now we're going to do the same thing for the back element here.
While the front one's on?
Yes.
Damn, I'm about to get shoulder fucked.
You might be a little bit sore after this. FYI. Have a good workout.
I have legs today.
Oh, it's legs. You're fine. Yeah, you're set. All right. There we go. I see it back here now. Is that comfortable? Is that tolerable?
Yeah.
Okay, perfect. So we're going to camp out for about 10 minutes. Okay. Yeah, that's all. All right, so Tareq just asked me a good question in terms of like what the therapeutic effect of the electroacupuncture is. Now, there's a reason that I like to turn the acupuncture up until we get that pulsation, and it's because that pulsation causes the muscle twitch, causes the muscle activation. Now, electroacupuncture functions based off the concept. Am I getting another phone call? Did I hear that right? No, I'm just going to talk from here so I can see the camera now. Electroacupuncture works off the basis of something called opioid-like theory. Now, people usually freak out when they hear the term opioid, rightfully so, because of the whole situation in the States, the opioid epidemic, right? But we naturally synthesize opioid-like compounds in our body. They're great at helping with pain. One method of doing that is with exercise. However, if you're in pain when you move, you're not really going to want to do that unless you're built like Tareq, and then it's different, right? So to that end, this is a way of synthesizing or stimulating the synthesis of those opioid-like compounds, thereby decreasing pain. So that's why I like to wait until I see the fasciculations. They don't need to be huge. They just need to be these small little pulsations. Okay. That's all we need. Does that answer your question?
Yeah.
Perfect. All right, Sarah, we can times 20 again. I'm gonna go ahead and take you off them now.
Good.
Okay.
Taking off my vibrators.
Yeah, that's we can't really be doing that in this office, unfortunately. So we're gonna go ahead and turn these off. Great way to avoid self-electrocuting myself. And now we're gonna go ahead and take the needles out. So the alligator clips are off. We're taking these guys out. These might sting on removal, FYI, but I'm pretty sure you're tough. So maybe I might be wrong. I don't know.
No, I'm gonna kill myself.
Please don't do that.
Oh. My
Good
shoulder's been
job.
violated.
Awesome. Well, if you're worried about your shoulder getting violated, face down for me, buddy.
Oh, okay. Okay. Bet, if you insist.
Tareq is getting that pain in the ischial tuberosity, which is going to be deep in this region here, probably even a bit lower.
Yeah, like right there.
Abouts,
Perfect,
okay.
right, yeah.
So that is what we use our needles for. Why are you looking at the screen, dude? These are going to freak you out.
Oh.
So, all
It's gonna
right.
go in my ass.
Yeah, not quite in, but definitely
In.
in. Yeah, in, but not in the in that you're probably more fearful of.
I'm so paranoid about like clutching up.
Don't worry about it, okay? So we're going to start with right there. Yeah, that's it there. Okay, so big breath in, all the way out.
Is it in?
Yes.
Oh, I felt it. Oh, I feel that shit. I feel that shit.
There you go. Perfect. And you did a great job of not tensing up, okay?
What if I tense up while it's in? I'm fucked.
Yeah, it doesn't really make a difference at this point, but still, you want to try to stay relaxed, okay? Come at it from a higher angle.
Woo!
Feel that one, eh?
Yep, yep. That one stung like a bitch.
You're okay, buddy. We got one more, okay?
Oh god. This is worse that one time with Diddy.
This is like the third Diddy joke, dude. You need more material, I'm sorry to say.
Fine, I'll use Epstein.
Oh my lord.
Oh god.
I think you deserved that one. I honestly think you deserved that one. Alright, and now to put on the current.
Oh god. Forgot about that part.
Yeah, I didn't.
My ass is gonna start jiggling.
Yeah.
Is it gonna be on for 10 minutes too?
If you can manage it.
Holy shit. My ass gonna start bouncing?
Yeah, actually, you will be twerking on this table.
Oh my god.
That's
I'm so paranoid now.
Why?
My ass, I feel like it's because the pulsation on my front belt was like a bit strong at first, so I don't know what to expect from my ass.
Let me know when you feel some tilt.
Oh,
there we
yep, right there, yep.
Okay, so the camera can see that, I think.
Sounds
Okay, so we're gonna censor that one out. That's okay. But there we go. Let's turn it down a bit. Is that better?
yes.
Okay, so we'll go right there. All right, and now we'll camp out for 10 minutes.
Oh my god. This is diabolical.
Yep, this is what I do for a living, dude. This is my career. For a second, I thought I turned the dial the wrong way. That would have been scary.
Oh, 100%.
Yeah. I would have been fine, but you
My ass would have
might
started
hurt.
jiggling.
Yeah, a little too much. It's not that kind of channel. I swear we're educational. At least that's what we're tagged as on YouTube. So yeah, you're gonna go ahead and take that out. Gonna go ahead and take this one out, and then last but certainly not least, take this one out. There we go. Tareq, how did you find? We did some weird stuff for the first appointment here, but how did you find all of that overall? Why don't you share?
Honestly, it I did not expect it. So, I don't know. I've never been readjusted before, so
That's
like
fair.
it's the first time. So I didn't like have any like expectations, but at the same time, like it was interesting. Like when you readjusted my neck, every time you readjusted it, I felt like saliva in my throat.
You felt a little bit like everything kind of suddenly opened up a bit.
Yeah, pretty much.
Yeah.
Actually, it probably helped. So like I had a thing where like my sinuses would clog up my ear, and so I felt like there was like a tube where it doesn't like flush it out immediately.
Would be the eustachian tube, by the way. But yes, there's
so like I feel like that would probably help realign it. Someday.
So here's my take on that. So I'm a very biomechanical based chiropractor, which means that like I don't claim to have any kind of visceral effect on somebody. Visceral referring to organ. Okay, everything I do is strictly physical. Everything I do is strictly mechanical. I will adjust some people's neck, and they will tell me that their sinuses immediately clear up, and they will tell me that like they feel like saliva in their mouth, or they feel like they kind of like warm up for a bit. I'm gonna be honest, I don't really know why. The only reason that I can think of is just that sympathetic nervous system response. It's a little nerve-wracking. That causes things to flush out sometimes. But no, happy to hear that that's the case, right? So that was the adjusting. Okay. How about the needles? Because you're not a big needle guy, but really. you put your game face or game butt on, and you handled it really well. A little sweaty, but really well. What'd you think of it?
Sweaty. I didn't anticipate that. I thought they were gonna feel like nothing. So the initial needle felt like it was like it felt like when you go to the dentist and they put like a syringe in your mouth, like it made that like bubbly feel, but it's not bad. It's not bad at all. And what threw me off was the pulsation. That one was like, oh, okay. And then I didn't know like what to gauge it at. So like when you first put it in the front delt, it felt like it was strong, and then it eased off over time.
You do adapt to them as they're in. Now, what I kind of messed up on admittedly was I actually didn't tell you that I do electroacupuncture until they were already in there. I just said needly. So that's on me, my bad.
No, you're good.
But the first needle there, the one at the top, that needle does go into the supraspinatus tendon proper, which is the one that's, in my opinion, repeatedly getting compressed. So it's understandable that's the one that's going to be the most tender out of all of them, okay? But still, you did great, okay? I'm interested to go see the gym after we go through the exercises there. Any other comments, concerns, or questions, anything else you might have for me before we go through the exercise and then sign off for today?
Not off the top of my head.
No? All right, well, if you do, you know how to contact me. I mean, I'll see you at the gym too. But awesome having you in. Thanks for coming in, dude. Much appreciated.
Don't forget to like, comment, share, and subscribe.
Thank you so much, Tareq.